If and we are live. We are live. Welcome to the Sickle Cell Crisis Prevention class. It has been an amazing journey. Mm. So I want to welcome everybody to the Sickle Cell Crisis Prevention course. It's going to be a long journey, one whole month. That's what we are spending together. So we just have to take it one day at a time because we have a lot of things to learn and we also have a lot of things. So if you are joining, please let me know where you're joining us from. And at the same time, let me know if you can hear me loud and clear. So if you can hear me loud and clear, kindly write loud and clear. Loud and clear. If you can hear me loud and clear, put it in the comment section, loud and clear. And let's go. We don't have a lot of time to wait. I want to appreciate because we are a few minutes late. I think it's the work back end. Yes, it's the work back end. So, okay, thank you, Moriam. Thank you for joining in. Thank you. So we are starting. We don't have to. Yeah, and if you are watching the replay, I also want you to take your time and listen to everything that we have to say here. Sickle cell crisis is actually one of those things that affect people living with sickle cell. It's the major thing about sickle cell. Unfortunately, there's a lot of misconception about sickle cell crisis. A lot of people don't understand that there is so much about sickle cell crisis that need to be learned, because if you don't understand what sickle cell crisis is, it is impossible for you to actually prevent sickle cell crisis. So today is just introduction to sickle cell crisis. And in this course, we have workbook, please. It means that after the class, we are going to drop your workbook. You have to do the workbook and submit. So we are taking a day off so that everybody can finish their workbook, and then we have another class on Wednesday like that, so we can meet up. So every time we hear physical cell crisis, the only thing that comes to our head is bone pain. Yes, is bone pain. So today we are going to talk about different types of sickle cell crisis that we have. We also want to talk about why is it important for us to prevent sickle cell crisis. We also want to talk about manifestation of sickle cell crisis, all in introduction to sickle cell crisis. So let me see if I can share my what is it called? Let me see if I can share my my okay. This is one of the things though. I don't know. I've been trying to check. Okay, maybe I will not be able to share my. Oh, because I don't know. Okay. Please, can you see me? If you can see me, let me see your comment. If you can see me, if you can see my face and you can see my slide, let me see your comment. Can you see my slide? Okay, good. If you can see my slide, please let me know that you can see my slide. Good. I think they can see my slide. So sickle cell prevention course. Let's go to, yes, I you can see it. So I just want to do an introduction of who is Kemi Ogutime. Why is Kemi Ogutime the one that is taking all these calls? I am Kemi Ogutime and a very passionate sickle cell advocate, and a specialist when it comes to sickle cell. I own a foundation, a not-for-profit organization, Ignite Sickle Cell Initiative, where I work with thousands of people living with sickle cell. And I have a unique solution to issues surrounding sickle cell, because sickle cell affected me differently. And because of this, every time I was asking questions from people, when I asked questions from people, a lot of them could not give me answer. And that's one of the things that picked up my interest. So I started learning about sickle cell at the age of 18. I was just a 100 level student at that time, and there was nowhere to have to turn to. Everywhere seems blocked. So I have to start learning about sickle cell myself. And then I proceeded after to learn about sickle cell in various ways. So I'm a certified genetic counselor, and I've worked with various organizations and consult for various pharmaceutical organizations on matters related to sickle cell. So whatever I'm trying to introduce myself to you means that you are in the right place. So when it's somebody that needs to teach you about sickle cell, then Kemi Ogutime is actually the right person that we teach, that the right person that should teach you about sickle cell. So the first thing we are going to do is to talk about what is sickle cell crisis. Introduction to sickle cell crisis. What are we learning here? We are in this course, we are trying to learn about sickle cell. We are trying to learn about triggers of sickle cell, symptoms, management, and prevention of sickle cell. Everything we are talking about this course talks about what exactly is sickle cell crisis. This is what we are going to learn in the next 30 days. We are going to learn about sickle cell crisis. We are going to learn about triggers of sickle cell crisis. We are going to learn about manifestation of sickle cell crisis. We are going to learn about prevention method using my framework, ACTS, prevention method of, and we're going to learn about management. And under all this, there are other aspects of sickle cell crisis that everything comprises. So it's going to be, like I said, it's going to be a very detailed course and a very long one, because there's no how you're going to teach sickle cell crisis without us going to all these basics. So let's start with what exactly is sickle cell crisis. I was using style to wait for other people so that they can join us. But anyway, if you are not able to make it, the replay will be available and then it will be posted on the group, and you can watch as much as possible. So what is sickle cell crisis? Sickle cell crisis occur when the sickled shape red blood cells block blood flow, causing pain and organ damage. Let me explain in a simple term. What do we mean when we talk about sickle cell crisis? The major problem of sickle cell crisis that leads to complications, damage, and everything start from the shape of the red blood cells. In people that doesn't live with sickle cell, those with AA, those with normal hemoglobin A, they have a red blood cells that is round. If you're looking at it at this slide, then you're going to see a blockage. You're going to see a round one, abnormal sickle cell, and then you're going to see a blockage where there is a blockage. Yes, the round one is like a ball round, flexible salt. So it flow easily along the blood vessels. Our blood vessel is just like pipe. So it means that this round red blood cells, normal one without any sickling, can pass through freely without causing any havoc, without causing any damages. But when it comes to the sickle cell, because there is a lack or there is an issue with our hemoglobin, it causes the red blood cells to sickle. It has a shape of a crescent moon or your or banana C or letter C. It formed that letter C, and that is where the major issue comes. At any time there is a sickling in the blood, it causes blockage. The red blood cells, the sickling blood cannot pass through the blood blood vessels without getting blood, and this is what causes our crisis. Now a lot of us think that everything that has to do with crisis is about pain. No, that's where the mistake is. As long as the sickling occur, there is a crisis going on in your body. Either it leads to pain or it doesn't lead to pain, you are going through crisis, no matter how you want to explain it. And this is why I keep explaining to people that sickle cell crisis is not just ordinary about bone pain. If it is like about that, then it means that it's only people that have bone pain. They will only be the one that will be disturbed, that will get disturbed when it comes to sickle cell crisis. But that's not it. Sickle cell crisis affect, as long as you have sickle cell, as long as your red blood cells is going through the sickling process, then it means you are in crisis. And these crises are of different type because everybody has a different manifestation of sickle cell crisis. So we are going to talk about it in the types of sickle cell crisis. So in that place, when the red blood cells is when the red blood cell becomes sickled and then it causes a blockage. If it causes a blockage in your hand, then there won't be red blood flow to that place. Your red blood flow that is going is not just going alone. The red blood flow, as long as there is a blockage with the red blood cell, it means that nutrients and oxygen cannot go to the other parts of that area that there is blockage. So in some people, they start experiencing pain. That's when at that point they start experiencing pain. In some cases, they don't experience pain. They have other symptoms. Where they have other symptoms, they have other manifestation of that crisis that shows that they are going to crisis. So we have different type of crisis. Either way, crisis is not just about bone pain. Bone pain is just one of the sickle cell crisis that we experience. However, it is the loudest because it comes with excruciating pain. So everybody focuses on that pain. It doesn't matter. Sometimes you are going through that bone crisis, and you're also going through other form of crisis which can actually, so in fact, some people will tell you that, oh, they don't have crisis, but at the end of the day you see them coming down with a lot of complications. How are you able to come down with this complication without undergoing crisis? It's because you are going through crisis. However, this crisis you are going through is not a bone pain. That is why you are able to have that point. As long as this sickling occur, then there is going to be damage, then there is a risk of complication. So either way, the major thing you can do is to prevent the sickle cell crisis. Types of sickle cell crisis. Where are the types of sickle cell crisis that we have? We have number one, the vaso-occlusive crisis. That is the one that every other person know as sickle cell crisis. The vaso-occlusive crisis is the VOC. It's also known as the bone pain. Anytime you are having crisis and you're dealing with pain, that is what you are dealing with, VOC. So that's when you get to the hospital and the doctor said she's going through VOC. You're going through vaso occlusion crisis. And vaso-occlusion crisis can occur at any part of the body. Yes, it is pain and it can occur at any part of the body. So it means that you can have crisis in your head in form of headache, you can have crisis in your hand, you can have crisis in your leg, you can have crisis in your butt, you can have crisis in your chest, you can have crisis anywhere, even your stomach, you can have crisis. That is the most common form of sickle cell crisis that a lot of us talk about. It is it involves severe pain that is caused by ischemia. What did I mean by ischemia? Ischemia means that there is no oxygen. Yes, the red blood cell is flowing, decided to get blocked because there is sickling, it got blocked, and because it got blocked, the red blood flow cannot move to the other part of the body. That area, other red blood cells that are coming, they decide to form a blockage, and you start feeling pain at that side. That is blockage, and that is what leads to ischemia or an infection. Then number two, the second type of crisis that we have is hemolytic crisis. When I talk about hemolytic crisis, people like me of have hemolytic crisis. Does that mean I don't have VOC? I have, but it's not every time. So every time I talk about preventing my crisis, every time I talk about not having crisis, I'm not only talking about bone crisis, because bone crisis is actually something that is not very common for me. So let's talk about hemolytic crisis. Hemolytic crisis is when the red blood cells begin to break down at a faster rate. Like I explained earlier, I said that if there is no sickling, then it's possible for us not to have crisis. But as long as there is sickling, there is going to be crisis. So in hemolytic crisis, the sickling occur, it doesn't lead to blockage, it doesn't causes pain, but the sickling affects the red blood cell. Because there is that sickling, the sickling affect the red blood cell to start breaking down. So now we have different manifestation of sickle cell crisis in different people. Some have the VOC, they tend to have vaso-occlusive crisis. Some people have the hemolytic crisis, and this hemolytic crisis is divided into two parts. We have the acute one, and we also have the acute one. We also have the hyperhemolytic crisis. What do I mean by hyperhemolytic crisis? Hyper means that the rate at which the red blood cell is breaking is faster, is extremely fast. That's why we like maybe fatigue or sudden weakness. It shows that something is wrong with inside your body that you cannot see. That's why we send you to go to the hospital, because immediately somebody is having a fatigue, it means that a person that has a PCV of maybe 30 can end up within a 24 hours or within 6 hours and end up with 15% of PCV. What's happened? That person is going through upper hemolytic crisis. And how do you know that you are going through hemolytic crisis? It has a symptoms. The symptoms include jaundice, a very dark urine that is not caused by dehydration, very dark urine not caused by dehydration, yellowness, jaundice, weakness. Those are the signs that you know that this person is going through hemolytic crisis. Anemia, yes. You see the person has become pale, they have jaundice all over their face. They are going through, and this is like the worst form of sickle cell crisis, because it doesn't show, it doesn't give you pain, it doesn't show. So it's dangerous, because you keep having that crisis, the damage continue in your body. You are not dealing with pain, and because of that you believe that I'm not supposed to go to the hospital, and it keep causing complications because it is a form of silent, it's not showing of your sign. Unlike VOC, that immediately you have VOC, you are dealing with pain. Everybody, the way you are shouting, everybody must know, they must know that something is wrong with this person. And what happened? They ask you, they want to take you to the hospital, they want you to know that something has been wrong with your body. Everybody shall want to help you because you are dealing with vaso-occlusive crisis. But the most dangerous one are those ones that are very silent, like the hemolytic and the hyperhemolytic crisis. they hardly show. So it's possible for you to be dealing with this kind of crisis, and you are managing your fatigue for a long time without even going to the hospital, and you just notice that there is a and one of those, the manifestation of this chronic hemolytic crisis involve, um apart from the jaundice, you realize that it affects the spleen. It can causes hyper it can cause enlarge of heart. Yes, the heart becomes enlarged because the heart starts struggling to pump blood. It becomes enlarged. That's one of the cardiomegaly. That's one of the complications that comes with hyper hemolytic crisis. You also have that hemolytic crisis also cause delay growth, because there is so much, the body is working extra hard to keep producing red blood cells, to keep meeting up, whereas there's something that keeps destroying the red blood cells without any issue. So no matter what you are trying, except you work with prevention, except you work in a place, except you work with prevention that keep preventing that sickling from happening, you will keep having crisis, and you keep dealing with the aftermath, which is the complications, the organ damage, and so on. So we have this sequestration crisis. When I talk about sequestration crisis, this is mainly common in children between is 0 to 5. Yes, it's very, very common between is 0. Does that mean that adults cannot have it? Adults can have it, but it is rare. It is rare. Anything from 6 years, 5 years, 6 years, 7 years, and above. It's hard for you to start seeing sequestration crisis. What is sequestration crisis? Sequestration crisis is when the blood gets trapped in the spleen or in the liver. So we have two types of sequestration crisis. We have the hepatic sequestration crisis, and we also have the splenic sequestration crisis. We always talk about enlarged spleen in sickle cell patient. In people living with sickle cell, we talk about enlarged spleen. This enlarged spleen is as a result of crisis. If there's no crisis, then the spleen is not going to get enlarged. So during this crisis what we call sequestration, the spleen trap blood inside it, and it causes pain. If you see children, realize that their stomach become extremely big, and it's palpable. When you touch it, you can feel their spleen with your hand. By the time you touch it, you can feel it. It's palpable. You can palpate it. You can feel it that something is here, something is inside this stomach. You can feel it that way, and you can even measure it with your hand, like maybe 1 centimeter, 2 centimeter, 3 centimeter. You can measure it. So in sequestration crisis is considered emergency, just the same way like hyperhemolytic crisis is considered a very serious emergency, but it comes with symptoms of both VOC and hemolytic crisis. So it means that when you have a child, the child is going through pain. At the same time, the child is going through symptoms. So it's feel like the child might be having jaundice, fatigue, weakness, and then they start shouting about their stomach pain. So the stomach pain is not everywhere, it's just their spleen, that area where their spleen is. So you can easily touch it and realize that, oh, this is where it. So when you notice that, you take them. Other places that the sequestration crisis can occur is at the liver. That is what we call the hepatic sequestration crisis. So in the 0 to 5, the liver can also trap blood in children living with sickle cell. It can trap blood, and when this trap blood, it is another form of crisis. It means that the liver is going through damage. Yes, and it's also painful, just as the same way the spleen is. But the hepatic crisis is not very, very, very common. When we say it's not very, very common, it means that we can see it in maybe 3 out of 20, maybe 3 out of 20 or something. It's not common compared to splenic crisis, that it is extremely common. And another thing that is very, very common is that people who go through hemolysis crisis are also very at risk of sequestration crisis. So it means that if you're going through hemolytic crisis, one of the things, other crises that you can also experience are the sequestration crisis, both in your liver and in your spleen. So it's either you are having splenic sequestration crisis, or you are not, or you are not. The last one, no, the second to last is the aplastic crisis. What is aplastic crisis? Aplastic crisis is sudden, it's a sudden worsening of anemia due to decrease in red blood cells. What happens in aplastic crisis? It means that your bone marrow suddenly stop producing red blood cells, and this can be very dangerous, and most time is caused after an experience. Maybe you have gone through a viral, you have been exposed to a viral infection. Yes, you have been exposed to a viral infection, or that's what causes the aplastic crisis. Aplastic crisis can be very, very dangerous as a hyperhemolytic crisis, because there is a sudden worsening of anemia. The body, no matter what you're doing, the bone marrow suddenly shuts down and they stop producing red blood cell. This is another form of crisis. And the last one I have here is acute chest syndrome. Acute chest syndrome is caused by sickling in the lungs. This is one of the things that causes high mortality in people living with sickle cell, because acute chest syndrome, acute syndrome is extremely dangerous, that it can take life in hours. It can take life in hours. So when you have somebody that is having chest pain, they cannot breathe well, their lung is collapsing, they are wheezing, they are trying, it's a lot for somebody to go through acute chest syndrome. Acute chest syndrome is more common in children between 0 to 5 years, but it doesn't mean that everybody living with sickle cell can eventually have acute chest syndrome. These are the four types of sickle cell crisis that I have explained. So if you have any question, please, you can easily drop your question in the comment section. You can easily drop your question in the comment section. I think I'm going to share the slides later. I'm going to share the slide, or maybe let me just find a way. I'm going to share the slide later to us. Manifestation of sickle cell crisis. When we talk about manifestation of sickle cell crisis, okay, symptoms of crisis. When we talk about symptoms of crisis, okay, symptoms or manifestation of sickle cell crisis is there are various symptoms that can mark a beginning of crisis. Most times we don't understand this crisis. We only focus on the pain. We don't understand that there is a crisis going on in the body, because if, despite the fact that there is a sign, we just not paying attention to it. I say it every time. There is no crisis without a symptoms. There is no how you're going to have crisis and something you are not seeing the sign. You are just not paying attention, no matter how it is. And most times we find it, we find it, we don't like it going to the hospital, especially either you are a parent or you're somebody that live with sickle cell. It is important for you to, when you notice these symptoms, go to the hospitals. When you go to the hospital, it reduce your emergencies. You take yourself to the hospital, you are having, oh, this is what I'm feeling, and then the doctor can just run tests. They just want to see, run some few tests, and then the results shows what they are going to do. They treat you, then you come back home. Okay, I think 2 weeks ago I have a client that I'm working with, and the client called me and said, oh, my child has been having fatigue, the child has been slow, the child has not been playing. And I said, okay, let's take to the hospital. Take to the hospital, we run screen, and what happened? The PCV was at 12%. 12%. The child, that's the only symptom that the child was. This is a child that has a normal PCV of 25%. At 12%, it was already at emergency. We were rushing up and down. and we're rushing everywhere to ensure that the child has a blood transfusion that same day. And I think the second day or the third day, the child was discharged. No stress, just blood transfusion, then the treatment, and the child was discharged because that 12% was already too low. And it was after the discharge, then the mother noticed that, oh, the child have, apart before the weakness, the child has also show other symptoms. Like a week ago, the child has not been eating, the child has lost appetite, the child has been the urine has been colored. Those are signs, those are symptoms that show that something is wrong with is wrong with your body. Everything about sickle cell is internal. Everything about sickle cell is internal, so you must need to pay attention extra attention. So let's talk about this manifestation of sickle cell crisis. The most notable one when you talk about crisis is pain. The pain can either be acute, the pain can be chronic, the pain can be severe, the pain can be mild, the pain can be excruciating. No matter what form is taken, it is pain. And immediately you have crisis, it is important for you to tackle it. When you don't tackle crisis, you are exposing yourself to further damages. You are increasing your risk of complications. And this is actually one of the things why we are having prevention class, so that we prevent it before it happens. And if we cannot prevent it happens, then we are doing early diagnosis. I will always say this: prevention is better than cure. Early diagnosis is better. So if we cannot prevent it, we want to diagnose it as early as possible. We want to diagnose it as early as possible. So those two things are key that we work with when you are talking about sickle cell prevention. Number one is pain. Pain can occur in any part of the body. When your child is having pain, the pain can show up in any part of the body: bone, joint, fingers, any part of the body, shoulder, and anywhere. It depends on the child. So bone pain, our VOC, vaso-occlusive crisis, can occur. So anytime you see pain is mostly linked with VOC. Number two is swelling. Swelling can occur. Mostly this one is very common between two children between 6 months and maybe 5 years. So you can have swelling when there is blockages in the vessels in the fingers and in down on the feet. So you can have swelling, what we call as hand and foot syndrome. That's what we call hand and foot syndrome. So it can occur, the hands will be swollen, and then it will be extremely painful. Is another form of crisis. Also with their legs. So sometimes a child might have both hand and foot will be swollen, and another that might have just maybe only the hand or only the foot. Fever. Fever can occur. Fever can accompany crisis when it is associated with infection. And sometimes it might not be associated with infection. Fever can just come depending, because there are various triggers of sickle cell crisis, which is what we are going to treat on Wednesday. That's why we are going to be exploring different type of sickle cell triggers that occur. How do we understand our sickle cell triggers? How do we um recognize it? What are the crises that occur? What are the things that we can use? Because there is no how you are going to prevent sickle cell crisis. Yeah, you don't know your triggers. You are just playing. You are just playing. There is no prevention of sickle cell crisis without knowing your triggers. You have to know your triggers, and you have to avoid it. Yes, you have to know your trigger and you have to avoid it. And it's not just only avoiding triggers alone that is prevention of crisis. There are other things that is part of the framework. That's why I said it's a 360 approach when it comes to sickle cell. Before I learned about, before I started learning about sickle cell, I am one of those person that, like I said, I have the hemolytic crisis. So it means that I'm always at the hospital, but not because of VOC. I'm not having pain. I'm not having bone pain. I'm always there, maybe for blood transfusion. Every now there's blood transfusion. Before you know it, 2 weeks later, I'm back at the hospital for blood transfusion. Until it went on like that until I was 18. It was on 18 that I actually got officially diagnosed for sickle cell. And that was when I like, oh, so whatever has been happening to me as a name. Okay, so why it has a name? Then let's find. I was in 100 level studying biochemistry. So, in science class, so I decided to start reading about sickle cell. And that was when I got my breakthrough. And from 2009, 2010, let me from 2010 to 2020, that was 10 years. 10 years without blood transfusion. I was able to achieve that. It was during my pregnancy. When I was pregnant, that was when I had blood transfusion and delivery and all that. That was when I was able to learn, start digging, doing my research, learning everything. Learning everything. That was when I started learning about sickle cell crisis. That was when I started asking, how does this sickle cell affect me? Because I was asking questions and it was as if nobody was giving me the answer. They did not understand. So I had to look for solution. And over the years when I started working, started my non-for-profit, when I started working with other organizations, I started working in health. I started working with I started working with, I started working in health before I start then my own organization. And when I started my own organization, then I realized that whatever I thought was uncommon was actually very, very common. It was extremely common. So there are a lot of people that are dealing with crisis and we don't know. So the only one we pay attention to is those VOC. If it is not pain, we don't believe that the child is going through crisis. So I have talked about fever. I talk about fatigue and weakness. If your child is having hemolytic crisis, one of the things we are going to do in our workbook is you want to tell us the kind of crisis that you notice that your child has been experiencing. We've explained it, and I think I'll still go back again to explain fatigue and weakness. And it's very common with hemolytic crisis. People that have hemolytic crisis, under hemolytic crisis, we have two types: acute and hyperhemolytic crisis. So that's when they become extremely low because their red blood cells is blowing faster and it's affecting the PCV, it's affecting their blood level. So they start dealing with anemia. One of the first symptoms of hemolytic crisis is anemia. The child is dealing with chronic anemia. The child is always anemic. So it means that maybe this month blood transfusion, the next month the child is pale again. It's because the child has been going through a lot of crisis, and because we don't know how to prevent shortness of breath. Yes, shortness of breath. When you are dealing with acute chest syndrome, one of the manifestation of acute chest syndrome is shortness of breath. You are breathing, your breathing cannot reach up, your breathing cannot reach down, and it also comes with pain. The chest is paining, there is wheezing. You can, as that person is breathing, you can hear the sound of their breathing. You can hear it. Something like that. You can hear those sound, those wheezing sound. Jaundice. Yes. So when you notice jaundice, even though the child is up and down, the child is jumping up and down, and you notice that there is a sudden jaundice, it means that something is going on within the body of the child. What is it? You need to start checking for it. Headache. Headache is also another form of crisis, another symptom of crisis. So if somebody is complaining of headache or dizziness, it means that they are going through crisis. You might not know exactly, because crisis can affect every part of the body. So it's either they're having crisis on the part of their head. Just understand that headache or dizziness can be a form of crisis. So, when we talk about I talk about VOC, I talk about few types of crisis, and I'm still going to explain in it in details. Is that VOC pain can actually last for a very long time when a child is having VOC. Because in my work, when you are on the field, you see parents, they are trying to tell you, oh, the child has been at the hospital, the child is still having pain, the child has been having pain for the past 1 week, and what happened, and they brought another. The One of the things that sickle cell crisis prevention does for you is to reduce the severity of your crisis, so that to the extent that most times you are able to manage at home with simple dose, with PCN, paracetamol. It can manage your pain. That's one of the but there is work to be done. When you are talking about sickle cell crisis, there is a lot of work to be done. Sickle cell crisis is not just something you want to do on and off. It's something you want to pay attention to. You want to you want to do it continuously, consistently. You want to build a routine with it, and it's the system of that we are actually going to teach in this course, the system of how you can constantly prevent sickle cell crisis. So VOC can last from few hours to several days to weeks. It is normal. It is normal. It is normal. We must put that at the back of our mind. And VOC occur when there is a blockage, obstruction in the blood circulation due to the sickle cell shapes sticking together and blocking the blood vessels. The symptoms of acute chest syndrome I've explained. We have chest pain, we have fever, we have difficulty in breathing, you have wheezing. There is a sound that comes out as the child is breathing. We have splenic or hepatic sequestration. The signs include sudden weakness, pale lips, fast breathing, enlarged spleen. The spleen is on the left side of the stomach. On the left side, the liver is on the right side. So the spleen, and sometimes someone can undergo both hepatic and splenic sequestration at the same time. A child can experience both at the same time. So the spleen is always located at the left side. So when a child is complaining of stomach pain, or they have abdominal crisis, you want to feel it. You just want to take your hand. If it is enlarged, you will feel it. It is something you can feel hard, and when you press it, it will be painful. So it means that the child is going through splenic sequestration, or they are going through hepatic sequestration. And the sign is, even before the pain, you started noticing sudden weakness, pale lips, fast breathing. They are breathing very, very fast. The enlarged spleen or the enlarged liver. Aplastic crisis, anemia, often triggered by infection with parvovirus. Anemia, I said it's always fatigue, and anything that deals with fatigue come with weakness, fatigue, jaundice, paleness. Hemolytic crisis. This is crisis involve and fast rates of red blood cells destruction. Over the years, I often explain to parents that if your child is having weakness, it is a sign of emergency. We want to check. We want to know what is wrong. Why is that child dealing with weakness? Weakness is something you shouldn't manage at home. This is one of the cause of death in people living with sickle cell. This is it. And I'm saying it now. I want us to pay a very serious attention to this issue. I want us to pay a serious attention to me. Hemolytic crisis Hemolytic crisis comes with faster. The red blood cell is breaking down at a very very fast rate, and the symptoms include jaundice, weakness, anemia, enlarged spleen that doesn't come with pain. The spleen is enlarged but it's not painful. And if you don't take quick action, the same can graduate to splenic sequestration crisis. Like I said, it's easy for you to, when you see a child going through hemolytic crisis, they also suffer from enlarged spleen. Um, Let me go to the next slide. Impact of sickle cell crisis. Impact of sickle cell crisis. Impact of sickle cell crisis. The impact of sickle cell crisis, it's actually on the extreme. Number one, if a child is going through crisis, either VOC, hemolytic crisis, no matter type of crisis, it affects the quality of their lives. People that go through other form of crisis, people that go through other form of crisis. Oh, thank you so much, ma. Yes, I think I have my water here. So now let's talk about the impact. Sickle cell crisis impacts the life of people living with sickle cell in an extreme way. Number one, pain. There is no how you are having pain and you can concentrate on anything. There is no how you are going to. Thank you, ma. I've taken water. There is no how you can. There's no how you can be having pain and you want to concentrate. It reduces your quality of life. You're not able to go to school. It affects your finances. There is no how if you are having crisis every now and then, you always go to the hospital. As you are going to the hospital, there is no how you are not going to spend money. You will keep spending money every now and then. You will keep spending money every now and then. So it affects your quality of life, it affects your financial life, both parents and children. So if you are adult, you are the one paying your own. Okay. Please, can you see me now? Okay, okay, good. Can you see the slide too? Yes. So when we talk about the quality of life, it affects the quality of life because you are not able to get employment, you are not able to finance. If you cannot work, how do you want to make money? How do you want to support all these things? No, it's not possible for you to be able to do all that. So it greatly affects and it's not only your own quality of life, it also affects the people surrounding you, your parents, your siblings, your friends, your partner. In every form, it greatly decrease the quality of life. Number two, repeated crisis leads to chronic pain. It means that you're not just dealing with pain on and off again, you are dealing with pain almost every day, and this is one of the reasons why crisis must be prevented at all costs. You don't want to be dealing the one that is very scary is organ damage. We have seen sickle cell warriors that have various multiple organ damage at the same time, and it is not easy. So how do you, and one of the only thing that leads to all these complications is crisis. If there is no crisis, there is no how you're going to be dealing with organ damage. Why? Definitely you must prevent sickle cell crisis, you must tame it, you must ensure whatever you are doing to prevent sickle cell crisis, you are giving yourself an opportunity to live long, you are giving yourself an opportunity to thrive, you are giving yourself an opportunity to have a quality life, you are giving yourself an opportunity to make money because you are able to get employed, you are able to make money, you are giving yourself an opportunity to have to reduce your risk of other complications. There is so much complication that comes with sickle cell. When we talk about organ damage, talk about organ damage mainly because organ damage is one of those things that before you start getting the symptoms, 80% of your organs are already damaged, 80% or 90% are already damaged, and some of us have lost a lot of people to organ damage that we have to learn that it is better to prevent it than for it to happen. So these are the reason why prevention of sickle cell crisis, it is very important. And I like working with parents, I like working with children because it is better for us to start preventing it. Some of us, we have to went through delayed growth, we went through delayed puberty, we went through a lot of stigma because of our delayed growth, we went through most of these complications, and it was never easy. So what do you do if you have children that are just coming and we already know that this thing can be prevented? Instead of them leaving them to start dealing with the stigma, start dealing with chronic complications, we can easily prevent it by doing the right thing from the beginning. So a lot of children I work with, they are developing well. You don't even know that these children live with sickle cell because we follow the rules, we do the right thing that we are supposed to do. So in our course of work, we are still going to talk about other form of prevention. Even all of us that used to think, oh, I don't used to have crisis, then there is no point for me to go for my routine checkup. Because your routine checkup is also part of your prevention. you must go for that routine checkup. It's not somebody that live with sickle cell. You prevent stroke occur in children from as long as they are living with sickle cell. You are at risk of having stroke from children between 2 years and till 16. They are at risk of stroke. So if you are not preventing sickle cell crisis, it means that you are increasing the risk of stroke in your child. You are increasing the risk of infection. So infection that comes with acute chest syndrome, osteomyelitis, we want to have AVN. Those are the lot of complications of sickle cell that you are preventing when you are dealing with, when you prevent sickle cell crisis. Organ damage, when we talk about our organs, we are talking about liver, we are talking about kidney, we are talking about lungs, we are talking about heart. Because as long as there is no delivery of oxygen, as long as there is a blockage that doesn't allow oxygen to be sent to some of these organs, then there is going to be destruction. It's going to get destroyed. Emotional and psychological impact. This is one of those things we don't talk about. There's no how. If you are living with sickle cell, I know those people that are living with sickle cell, that are hard or that are here, they can tell you sickle cell affects us emotionally and psychologically. A lot of sickle cell warriors are dealing with anxiety, depression, post-traumatic stress disorder, low self-esteem. It's a lot because there's a way people look at you, there's a way people treat you, especially when you live with sickle cell. There's a way they treat you. So it's not just talking about the physical aspect of crisis. We are also talking about the emotional, the psychological aspect that affect how the child start relating to people, that affect their outcome, that affect how they are able to thrive. Because there is no how you are dealing with emotional and psychological effect that you can thrive, because you will be dealing with so much negativity, you will not be able to thrive. There's social impact, educational challenges. I talk about educational challenges. As long as you are getting hospitalized every time, how do you want to get to education? So we see a lot of sickle cell that have dropped out of school. We see some of them that have been abandoned. The parent decide that I cannot be sending you to school because every time you pay, the child is not able to finish their school fees. The child is not able to finish the child is not able to finish a semester. So they have to drop out because there constant crisis. Employment difficulties. If you are always sick, it's the let us be sincere. There is no employer that will employ somebody and you come to work for 1 week in 1 month, then another month you did not come at all, then June you are coming to work, you attend work just 1 week. There is no employer except maybe the federal government or the state government that can actually take that. If it is private individuals, they have to let that person go because you are affecting their business. Business is profit oriented. Pre Business is profit oriented, and as long as you are not returning that impact to them, as long as you are not adding value to their workplace, they want to let you go. And this is one of the reasons why people living with sickle cell often face employment issue. So it's not as if you are not good enough, or it's not as if that, so maybe some of them they just feel like, oh, we don't want to deal with it, this person will always fall sick, and then sometimes they use that general idea to judge everybody. Social isolation, when you are constantly sick, at a point in time you don't want to tell people that, oh, I'm sick, because they will tell you, ah, are you sick again? So you want to start isolating yourself, you want to start limiting. Yes, you, I no wan go to Asaba because I'm a warrior. Exactly. So you can see a lot of people have this kind of challenges, and it's economic impact, healthcare cost. It is very expensive to manage sickle cell, no matter how you want to say. If you are constantly having crisis, if you are constantly dealing with different crises, it's going to affect your finances. I we hardly have health insurance that takes people living with sickle cell, even private. And when they are taking it, it is very very expensive. So you don't want to. Either way, it affects your economic impact. It affects you. It affects you every time. It affects you, and you are wondering what exactly. How can I do it? You are spending money. You did not have a job. Why would that person end up with depression? And sometimes we often feel like it's only the adult that have they have the psychological impact. Even children, the burden of sickle cell is on their shoulder. You see them, they don't want to go to school. Their friends see them as fragile. Everybody do not want to play with them because they believe that they are going to fall sick very soon. They are going to fall sick very soon, and it affect them. They carry the burden of sickle cell. Loss of income. When we talk about loss of income, we are not only talking about people living with sickle cell, we also talk about parents that have children with sickle cell. Because why? If you are constantly taking excuse, my child is sick today, my child is sick tomorrow, my child is not feeling fine today, my child is, some employer will have to let you go. Please go home, go and take care of your child. And it's going to affect your economic impact as a family. It's going to affect you. You're not able to make more money again. Overall life quality of life, lifestyle restriction. There is a lot of lifestyle restriction that come with sickle cell, and all these things affect. They are the impact of sickle cell. And one of the things I've done well for myself is that I've when you prevent sickle cell crisis, when you learn sickle cell management, it is easy for you to thrive with sickle cell. It doesn't mean that you are not dealing with some restriction. You are dealing with it. You are dealing with restriction, but at the same time, while you are dealing with those restriction, you also have a lot of opportunity. You also have a lot of options. You also have a lot of you know that I'm doing my work, and sickle cell has not been resisting me compared to when I was younger. Sickle cell was not as it has not been resisting me because I've been able to learn about management, about preventing my crisis. So it means that if I want to travel, people don't get bothered about me at home and feel like, oh, don't go, you know where. If I'm going for my travel, if I'm going for my business travel, if I'm going for conferences, I have the ability to go because I know how to manage. That's one of the things that comes with sickle cell prevention. So why sickle cell must be prevented at all costs? Why do we have to prevent it? Reduction of acute pain, reduction of acute pain and suffering. Prevention of organ damage. I said it. Sickle cell crisis is one of the things that leads to organ damage. We talk about organ like lungs, your heart, your kidney, your liver, and sometimes people can have multiple organ damage at the same time. We want to prevent organ damage. We want to decrease hospitalization and medical interventions. We want to decrease. That is why we are talking about sickle cell prevention. The more you prevent sickle cell crisis, the more you reduce the money you spend, the more you reduce the hours you spend in hospitalization. Yes, when we talk about hospitalization, it doesn't mean that, okay, I didn't have crisis, but I go for hospital for my routine checkup. But that one day, maybe once in a month, it's not a big deal compared to when I have to spend a week or 2 weeks at the hospital. You can't compare both. Improvement in your mental health, there's a way you look at yourself better. It increase your quality of life. You have some things you want to do. It increase your life expectancy because you are not just feeling hopeless. You realize that, oh, I have a dream and I want to focus on my dream. It improve your mental health. You are not dealing with the stress that comes with hospitalization. You are not dealing with stress that comes with looking for red blood cells. You are not dealing with stress that comes with money because you don't have the money to deal with all these issues. You are not dealing with all those stress. Reduction in economy burden. You are able to manage business. If you cannot work under somebody, you are able to manage business. It helps you. Improvement in social and economy opportunity. You are able to go to school. You are able to reduce the way you you are able to improve your your employment of the, it's not every time. So your people can actually employ you and know that, oh, you will deliver on your job. Even though when you are doing your own business, people can trust you. So it improve family and caregiver quality of life. When we talk about crisis, it's not only sickle cell warrior that it affects. So it affects our caregiver, the parents. Parents, if you are parents and you are here, please let us know how it affects you. You will not be able to go to work, but when you prevent sickle cell crisis, it improve your family and quality of life. It improve you that you are taking care of that child. It improve your quality of life. Not sleeping. When you are not sleeping, a lot of parents have developed hypertension. Some of them have developed a lot of chronic disease, all because they are constantly staying awake, they are constantly thinking, they are constantly at the hospital. It affect them. It also increase in consis ten cy in school and work at ten dance. So and the last one, we are already at the last one where I want to talk about it. There's something I want to say for us to understand. Every pain is not sickle cell crisis. One of the mistake we make with sickle cell crisis is for us to think that every pain is sickle cell crisis. And even at the hospital, so if you don't really understand your crisis, how crisis affect you, it's easy for you to take crisis to mistake it together. Every pain is not sickle cell crisis. So you might be having some pain because you live with sickle cell, doesn't mean you cannot experience other pain. It's because you have crisis doesn't mean you cannot have pain that come from ulcer. It doesn't mean you cannot have pain that come from appendix. It doesn't mean you are immune to other pain outside sickle cell crisis. So while we are dealing with sickle cell crisis, we also want to know that there are difference between sickle cell crisis and some pain. So every pain you are feeling as a sickle cell warrior is not a sickle cell crisis. And let me recap again, and we can finish this group. So tomorrow we are going to deal with triggers. So tomorrow, is it tomorrow on Wednesday? Tomorrow we are going to be doing our work. So I'm going to drop our worksheet in the group, and you can answer the worksheet. The worksheet is very, very important for us to answer, because this is what let us to know that okay, whatever we have gone through, we are able to learn it, we understand it. And if you don't understand, don't worry. If you don't understand, I will organize another class. I will teach it all over again. I I like teaching. I will teach it all over again so that we understand it. So let's go all over again. I talk about types of crisis. We talk about crisis, how crisis occur. And I said that crisis occur when the red blood cell, the normal red blood cell, becomes sickling. You know, when it becomes sickling and then it causes a block, when there is a blood flow, our blood vessels are just like pipe. The normal red blood cells, they are round, they are flexible, and then they easily pass through the blood vessels. But then the sickle one is hard, it is rigid, and it is round. It is not round, it is like the shape of banana or sickled. And while it was going through the blood vessel, you can easily block it. Immediately there is a blockage in the red in the blood vessels, we start leading to crisis, because at that point in time the blockage causes decrease in oxygen. So it means that the other part of the body cannot experience oxygen. And this is what leads to crisis. And then we talk about the type of crisis that we have. We talk about number one, the VOC, which is the very, very common one that everybody understands. VOC, vaso-occlusive crisis, the one that comes with pain, the bone pain. My hand is paining me, my back is paining me. That's the most common pain that everybody gets, because it comes with different form of pain. It comes with excruciating form of pain. So we are louding it. That's like the most common form. But we also have other form of crisis. We talked about the hemolytic crisis. The hemolytic crisis means that the red blood cells is breaking down at a faster rate. And we have two types of this hemolytic crisis. We have the acute and we have the hyper hemolytic crisis. The hyper hemolytic crisis means that the red blood cells is breaking down at an extreme fast rate, while the acute is. And I talk about the symptoms. How do you recognize that somebody is having an hemolytic crisis? The person is dealing with jaundice. The person is dealing with weakness, fatigue, chronic fatigue. The person is dealing with um, mm, fatigue, weakness, anemia. So they are constantly needing red blood cell blood transfusion. So even though you know that my child is not always having sickle cell crisis, but your child is always having red blood, is always taking blood transfusion, it means that that child is going through hemolytic form of crisis. It doesn't mean that everybody must have VOC. And I use myself as an example. Then we also talk about the other form. We talk about aplastic crisis, which is often caused by virus infection, parvovirus, when the red blood the bone marrow stop producing red blood cell. Then I talk about the splenic secretion. Splenic secretion is of two types. We have the hepatic and we have the splenic secretion. And I talk that this one often affects children between 0 to 5, but it doesn't mean we cannot see it in adults. We can see it in adults. It comes with a large spleen. It comes with pain in the spleen. It comes with dark urine. It comes with jaundice. It comes with fatigue. It also comes with anemia. And I explained that this hepatic um this sequestration crisis means that the spleen or the liver trap red blood cells inside. They trap red blood cells and it starts to causes pain and other form. And I also mentioned something that if you are of the type that you have a hemolytic crisis, it is one of the things that you can also experience is sequestration crisis, because when you are dealing with hemolytic crisis, you are it affects your spleen. Your spleen becomes enlarged, and it's very easy for that person to develop a sequestration crisis, either in the hepatic or in the spleen. Then I talk about hepatic means liver, the splenic means spleen. The spleen is at the right side of the stomach and the liver is at the right side. So when you're dealing with it, comes with pain. So when you have a small children and they are having crisis, it can easily you want to know what kind of crisis did they have, what type, because if you don't know the type of crisis they have, you might not be able to take care of them. Then I also talk about the last one that we have. I talk about the acute chest syndrome. I talk about the symptom. The symptom is difficulty in breathing, wheezing, pain in the chest. And that's why we said that if you are having chest pain in sickle cell, it's considered as emergency. Then we talk about other forms. I think I'll be able to finish everything for today. Today is just an introduction. In the group, I will be dropping. If you have any question, please kindly drop your question here. I will answer your question, and then we continue on the group. While you are listening to this message again, over and over again, the replay will be on the group. While you listen to this message over and over again, you might want to, because you have to listen to it again in order for you to do your worksheet. Please, the worksheet is very, very important. You are paying for it, and it is important for you to get the best out of it. So in our worksheet, we are going to recognize the type of crisis that we experience. We also want to explain what are the symptoms of this crisis. So if possible, we can also do a how will I put it? We also do a review on the group so that we understand. If you also have question, please drop on the comment section. Let me see. I will take it. And if you cannot drop it here, drop on the group. I will always attend to our question. So on Wednesday, we are having another live class. And what we are dealing with in module 2 is triggers of crisis. It's already getting more interested. Triggers of crisis. We want to talk about everything that trigger crisis. Like I often say, there is no crisis without a trigger. There is no how. Either it's an internal trigger or it's an outside trigger. So we are going to talk about the internal trigger. We are also going to talk about the outsider trigger. What are those things that trigger your crisis? And how do we recognize these sickle cell triggers? That's what we'll be doing on Wednesday. So tomorrow, all what we are going to do is to attend to our worksheet, do it, and submit on the group. So thank you so much. I'm still waiting for a question. Do you have any question? Do you have any question before we end this class? So okay, so I'll, because I'm not seeing any question now. No question. Okay, so in the answer to the question, we are going to end this live stream. I think maybe I'm going to do something. I'm going to maybe re-edit this slide so that at least it can come out better. I'm going to re-edit it and find a way to maybe give to us on the group if you want it. But if not, the replay is always available. So thank you and see you on the group. I'll be dropping the worksheet almost immediately. Bye. So see you on Wednesday for our class. Do not forget, we are dealing with triggers of crisis. Bye.